Unfortunately, as a GP, I see firsthand the devastating impact that an eating disorder can have on an individual and family. And I think they're often portrayed in the media as a teenage girl fad, but they're so much more complex than that. Eating disorders are complicated, serious mental health conditions which can affect any age, any gender, any background. In the UK, the statistics paint a stark picture. Beat, the UK's leading eating disorder charity, estimates that 1.25 million people suffer with an eating disorder in the UK, 25% of whom are male, and a large proportion of which fall outside of that typical teenage stereotype. And unfortunately, the numbers are increasing. In the past 5 years, the hospital admissions for eating disorders have doubled. There are several different types of eating disorders, all with their unique set of challenges. The most common include anorexia nervosa, which is characterised by severe weight restriction and a distorted body image. There's bulimia nervosa, which is defined by cycles of binge eating followed by purging behaviours like vomiting or excessive exercise. And there's binge eating disorder, characterised by recurrent episodes of uncontrolled eating, often then accompanied by feelings of shame and distress after. Signs that you or a loved one might be suffering with an eating disorder can include significant changes to eating habits, things like restricting food, binge eating, purging, preoccupation with weight, body image and calories, exercising excessively, social withdrawal and mood changes, and fatigue, weakness, and difficulty concentrating. Despite popular belief, eating disorders aren't just about food. They extend beyond food and weight concerns. Often individuals with eating disorders use food and eating habits to cope with emotional distress, to control aspects of their lives that they feel out of control with, or just to manage underlying psychological issues such as depression, anxiety, past traumas. So recognizing this multifaceted nature of eating disorders is crucial to early detection and comprehensive treatment. There are a number of underlying risk factors that could put you at increased risk of developing a eating disorder. One of them is genetics. There is some research to suggest that there can be a predisposition genetically in some cases. Mental health conditions tend to coexist, so things like depression, anxiety, and OCD. Societal pressures, so body image expectations and societal emphasis on thinness can be triggers. And so can personal experiences, things like trauma, abuse, or bullying, which can all increase vulnerability. Early intervention is crucial for recovery. So if you or someone you know is struggling with an eating disorder, there are a number of steps that you can take. Firstly, talk to your GP. It's important to seek professional advice and assessment, and your GP can give you initial support, but they can also refer you to a specialist and discuss treatment options. And depending on the severity of your eating disorder, treatment can involve individual therapy, family therapy, nutritional counselling, and medication. Secondly, get support from charities like Beat. They offer a helpline, online resources, and support groups, and they can provide that invaluable guidance and connect you with others going through similar experiences. Thirdly, educate yourself. Understanding eating disorders can help you manage the symptoms and also help advocate for yourself and for your loved one. But just make sure that you're getting the information from reputable sources. Lastly, build a supportive health system. Surround yourself with supportive people who understand and encourage you. Remember, you are not alone. Eating disorders are complex, but recovery is possible with early intervention and access to appropriate support. So if you are concerned about yourself or someone you know, don't delay seeking help.